This is Mr. Hospital Bed, aka Sean with USA Med Bed, and we're looking at the best beds for 2026. And 2026 came around fast, as it always does. All the years go by, but the hospital beds for the used, refurbished, and new hospital beds, there's always new models coming in, and there's always new beds that are more popular than others. A lot of the beds right now, though, for 2026 will be the same ones that we've seen in prior years. Now, the very first bed is the Hill-Rom Progressa. The P7500 Progressa bed is still, and probably will be for the next few years, the best hospital bed money can buy. This hospital bed has a full chair position, which I've got it in now. And you can see it's a little bit higher off the ground. I lowered it all the way down. And then what I did is I did the egress, which basically lifted this section up. And you can see it's at a little bit of an angle. So it helps the person get out of the bed once they basically have put it into a chair position. And this bed also has pulmonary. It has lateral turning, which means that it can turn the person all night long. And the Hill-Rom Progressa bed comes with multiple different mattress options. So there's a pulmonary mattress. There's a mattress that has the lateral rotation, which what that basically means is that the mattress will turn the person all night long. We can come over here, and actually we've got one on display. That's if I hit lungs and come in here, you can see rotation. And then I can basically turn the person. Now, for testing purposes, we have it at 1 minute, but we don't need training mode. We'll take that off. And then what we can do is we can determine the degree of turn. So you can see here, 20% degree turn every 30 minutes. And basically, and then if we go back in again, and we've got the percussion vibration feature, then we can also basically help with the upper respiratory. And so that's actually not turned on right this second. But for the sake of the video, I think you get the idea. The Progressa bed sits fully into a chair. And then you've got what we have here is the pulmonary surface. And then you've got the Hill-Rom Progressa with the therapy surface. And the therapy surface is just low air loss, but it does have turn assist, meaning that it'll help turn the person to the left, help turn the person to the right, just to change out bed linen. So it just does it one time and then stops. And that's actually a really good point to bring up in this video. There's a difference between lateral rotation, which we just saw, that turns all night long when you turn it on, and turn assist that just does it one time to help the assistance of the caregiver to help bathe or change out bed linens or whatever needs to get done. So if you don't need the full pulmonary and you don't need the patient turning, you can go with the Hill-Rom with the therapy surface. And then there's also a Hill-Rom Progressa, which is just a foam mattress only as well. So that's another option that you would also have there for that as well. One of our all-time best-selling mattresses and beds is the Hill-Rom Versicare. The Versicare bed is an older bed model, but it's super reliable, very durable, and it comes with multiple different air surfaces. This is the P500 with low air loss. And this bed also can come with foam or air. Now, the Versicare bed really provides a lot of great value. It sits a little bit lower to the ground. So for some folks, it's a little bit easier to transition in and out of bed, especially if you're dealing with the wheelchair. But it's a really durable, reliable bed. A newer version of that would be right next to it, which is the Hill-Rom Advanta 2 bed. And the Advanta 2 bed is basically a newer version of a Care Assist. So we get the Advanta 2s in, also a really good bed, very reliable. All these beds have controls on the inside rail there for the caregiver that you can see. And these beds all have drop-down rails that drop down out of the way. So for the Hill-Rom beds, you've got the Progressa, you've got the Versicare, you have multiple versions of the Progressa bed, and then the Advanta 2. There are some other bed models that they do have. We don't have them in the showroom, but these are definitely our top bestsellers, and these are very reliable beds. The other beds that are in our top most popular list, as always, is going to be the Stryker Secure 3. This is just a phenomenal bed. Stryker is a kind of a direct competitor with Hill-Rom. And this particular bed, in addition to having the controls on the outside rails, and you can see, you know, the controls on the outside of the rails on all these beds, The Stryker bed has it, and then in addition to that, also has a station, what we would call a caregiver station, where you've got bed exit alarm, you've got a scale feature, and then you do have your regular features here like Trendelenburg, which is always kind of a hard term to pronounce, but that's another bed, another section that we've got. Right next to it is the Stryker Secure 2, an earlier version of the Secure 3. And once again, you do have a care station there. The Secure 3, though, for the most part, is really the most popular one of these, only because, it's just been out for so long and so many of these beds have been made that they're used in hospitals and they come out a lot. Now, for one of the newest beds that we've just gotten in, and this is really very, very neat. This is the Bradshaw Junior. This is made by Drive. This is a brand new bed, and this is a pediatric bed, or a bed that's made for kids. And so this is a full electric hospital bed here that has a full set of patient controls, which we can show you. And I like it because it doesn't look as scary as what we've been told as a regular hospital bed. And you have these wooden side rails, which me and my little brother had when I was a kid, that we used for bunk beds. So it's really about the size of a bunk bed. It has dual buttons right here. So in order to bring the rails down, you have to press this on each side, and there's another button on the other one. And that's how you lower the rails down. So the kids can't, let themselves out of bed unless they want to be, or you can see here, you can also set it so that it's put in that position. So you have the Secure 2, the Secure 3 from Stryker. You've got the Advanta 2. And then there's another bed over here also that we've got, which is a high-low bed. And this is a bed that's called a CHG bed. It's actually a bed that was made and sold by Stryker, made by CHG. What you find in the hospital bed industry is that many times what happens is that a company will look for a bed that they need for their inventory, and it's going to be cheaper and easier to just buy a company or buy their bed than it is to try to make one. And in this case here, Stryker went out and bought CHG and started making these high-low beds. And this is a really great bed. You can see also it's got all your controls on the inside rail. Now, this bed sits 11 inches off the ground. And if you look at the mattress is 6. Just for the notes, in the medical industry, all foam mattresses are 6 inches. All air mattresses are 8 inches. Okay, so if you have a bed that's about 10 and a half, 11 inches, and you put a 6-inch mattress, the height off the ground from right here is about 17 inches. And so wheelchairs are normally 18, 19, maybe 20 inches off the ground. So what that basically means is that when you drop this bed flat, the person in a wheelchair can slide off and kind of slide down onto the bed. And so high-low beds, and we sell a lot of those from Drive and Invacare, but this is a really good high-low bed. This is a hospital-grade bed. And when you say hospital grade, what that basically means is that you're always going to get the Trendelenburg and reverse Trendelenburg, usually have a scale, and anything that has Trendelenburg basically sits into a chair position. So you're always going to have a chair position as well. Chair position is really important for people that spend a lot of time in bed because it sits you more upright. It's good for circulation. It's better for recovery. It's a lot more comfortable. And so if you're spending time in bed, it's going to give you the ability to basically be comfortable in bed and still be able to get in and out of wheelchairs and do other things like that. Air mattresses, once again, are primarily for people that spend the majority of time either sitting down or in bed. They're at risk of getting bed sores. These beds run air over the surface of the mattress, and what that does is it whisks away moisture to keep skin dry, because bed sores, pressure wounds, skin ulcers, they go by a lot of different names, are basically a combination of moisture and friction on the skin. So if you can avoid bed sores, or if you've gotten into a situation where the person has bed sores, this is going to be one way that you can go about either preventing them or treating them and getting rid of them. And so, the first thing that I do when we talk to folks is ask them, hey, how much time is the person in bed? Do they need foam or air? And with a lot of these beds, like with this one here, we could take this foam mattress and make it an air mattress, but this actually does have an attachment on this particular mattress we have on here to be converted to an air mattress. Beds like the Versicare, that can come with foam or air. This can come with foam or air. This, once again, can come with foam or air. And you can hang the pump right off the foot of the bed. You can kind of see how we did it over here. So a lot of beds, if you start off with foam and the person, becomes less mobile in the future, then you can convert them to air. The Isogel is the best mattress made on the planet, really, that's foam. It's a gel foam mattress, and we get those from the hospitals and basically can provide those and sell those and offer those with the hospital beds. So when you're dealing with hospital beds in general, the top brands that are hospital grade beds are going to be Stryker and Hill-Rom. And then you've also got like really high-end home care beds, which would be Drive and Invacare and Jorns. And so we basically provide a wide selection of both new and refurbished used hospital beds, because basically, people get out of a hospital and they get something from insurance and it's not very good. You've seen videos I've done in the past. I don't have any of those beds in here right now, but the brown beds with the spring and, really poor quality mattresses, and the person getting out of the hospital is just basically very uncomfortable. And so what happens is that people come into the secondary market because Stryker and Hill-Rom do not deal with home care. So if you needed a really high-end hospital bed, and we're talking paraplegic, quadriplegic, ALS, MS, heart attack, stroke recovery, you in this day and age, you know kind of what this is entailing, but these are the kind of beds that you need for people that really need a serious high level of patient care. And so we've got locations in San Diego, California, which services all of San Diego, Southern California, LA, Arizona, go all the way up to Seattle over there, Colorado. But then Richmond, Virginia, where we're at now, we go all the way up into New York, New Jersey, Connecticut, Maine. We do a lot of deliveries down into Florida. We're getting ready to open up down in Sarasota, Florida. And then we ship a lot of beds into Texas, Ohio. We ship beds all over the country. So if you're looking for a really good hospital bed, we really know the beds well. We know probably what's going to be the best model for the best price range. The other thing to understand is that there's 3 types of hospital beds. There is home care, which I would just say low-end home care. There's high-end home care, which is, better quality than what you're going to get normally from insurance providers, and it can still be pretty useful. And then you have hospital grade care. And so when you're dealing with hospital grade care, you're dealing with the highest level of patient care, which once again is really primarily for, people that need high levels of patient care. We deal with, patients that are on feeding tubes and trachs and ventilators. And I mean, these are people that are at home that need high levels of patient care. So we've got Hill-Rom technicians, certified technicians that go through all the beds. We have fantastic support and customer service on the back end. We usually pick up the beds and have them custom dropped, and we can arrange shipping and all the different parts that go into it. Fantastic staff, great customer service. So Mr. Hospital Bed here. It's January 2nd, 2026. We're already getting started to showcase the best hospital beds available for 2026 in the used refurbished categories. And we do have a few of the new beds. We'll probably do some with the Drive beds and some of the other bed models because we do carry those as well. So if you're looking for a really good quality hospital bed and you're not sure where to go, give us a call. I mean, I've been doing this, like I said, almost 20 years. People have people in the hospital. The staff comes up and says, hey, your mom, your dad, your brother, your sister, they're going to be out in 2-3 days. And you need to get a bed, and everybody's going, oh my God, what do we do? We're used to that. That's just another day at the office here. So give us a call for more information. You can go to mrhospitalbed.com, which is just mrhospitalbed.com. You can also go to hospitalbedshop.com. Our one hospital bed site, we're in the process of upgrading that. So it's another site that's been out there for a better part of 15 years, but it's time for that thing to get cleaned up. but Mr. Hospital Bed. And give us a call, San Diego, California, 858-263-4894. Richmond, Virginia, 804-495-0770. Give us a call and let us walk you through the best models that are going to be best for your price range, best for the patient needs that you're going to need, and walk you through any other equipment that you might need as well. Once again, this is Sean Callahan, aka Mr. Hospital Bed, here at USA MedBed in our Richmond, Virginia showroom. Thanks for watching our video. Subscribe and share, and we'll see you on the next video.